Okay, I need to talk about this. Because last week, a patient came into my office with a second-degree burn, not on her hand, not on her arm, on her vulva, because she had been sitting over a pot of boiling herbal water for 20 minutes, because someone on the internet told her it would cleanse her uterus and balance her feminine energy. She was in real pain. She was embarrassed, and she kept apologizing to me like she had done something stupid. And I kept telling her, "You didn't do something stupid. You did something that millions of women are being told is good for them by people who have absolutely no idea what they're talking about." I'm Dr. Anna. I have been a gynecologist for over 15 years, and today we are reacting to vaginal steaming, or V-steaming, because the wellness industry has been selling you a fantasy about your own body, and I will not stay quiet about it any longer. We're going to talk about what V-steaming actually claims to do, what your vagina and uterus actually need. Spoiler, almost nothing. And why some of these practices are not just useless, but genuinely dangerous. Stay with me. Because by the end of this video, you are going to understand your body better than most of the people selling you these products. Let's start with what vaginal steaming actually is, because some of you may have seen it all over your feed and genuinely aren't sure if it's legitimate or not. That's fair. The marketing is convincing, the aesthetics are beautiful, and the language sounds scientific enough to be plausible. V-steaming, also called yoni steaming in some wellness spaces, involves a woman squatting or sitting over a container of hot water that has been infused with herbs. Common herbs used include mugwort, rosemary, wormwood, basil, oregano, and lavender. The steam is supposed to rise into the vaginal canal and, according to proponents, travel upward into the uterus. The claimed benefits are extraordinary. Depending on who you ask, V-steaming is supposed to cleanse your uterus, regulate your period, reduce cramps, heal after childbirth, treat bacterial infections, clear out old blood, balance your pH, improve fertility, relieve endometriosis symptoms, tighten the vaginal walls, and even improve your sex life. I want you to really hear that list, because it tells you something important. When a single practice claims to cure that many different, unrelated conditions, that is not medicine. That is marketing. Think of it this way. Your uterus is a closed internal organ. It is not a chimney. Steam from outside your body does not float through your vaginal canal, past your cervix, which is largely closed, and into your uterus to do anything. That is not how anatomy works. That is not how steam works. That is not how any of this works. Here's what's actually going on inside the culture around this practice, and why so many intelligent, health-conscious women have tried it or are curious about it. V-steaming isn't new. Variations of it have existed in traditional practices in Korea, parts of Central America, and some African cultures for generations. And I want to be respectful about that context, because traditional practices often carry cultural meaning that goes beyond the physical. Ritual, community, postpartum care, these things matter. But here's the part most doctors don't explain. There is a significant difference between a cultural tradition and a medical treatment. And when the wellness industry takes a cultural ritual, strips it of its context, repackages it in a rose quartz and linen aesthetic, attaches a list of medical claims, and sells it to women for $50, $100, $200 a session, that is not traditional medicine. That is exploitation of the tradition and of you. The reason it went viral, the reason it exploded in the mid-2010s and has never really gone away, is that it speaks to something real. Women are frustrated. Frustrated by how long it takes to get a diagnosis for period pain. Frustrated by doctors who dismiss their symptoms. Frustrated by a medical system that hasn't historically taken women's pain seriously. And when someone comes along and says, "I see you're suffering, here's a beautiful natural ritual that will heal you." That feels good? Of course it does. Your body is basically trying to find something, anything, that acknowledges the pain is real. I understand that. Completely. But understanding why something is appealing doesn't make it safe or effective. And the wellness industry has weaponized women's very legitimate frustration with medicine to sell them things that don't work, and sometimes actively harm them. Let me walk you through what is genuinely happening in your body when you sit over that steam, because it is not what you've been told. Your vagina is a self-cleaning organ. I cannot say this enough, and I will keep saying it until every woman on this platform has heard it at least once. It has its own carefully balanced microbiome, a community of bacteria, primarily lactobacillus, that maintains an acidic environment, protects against harmful organisms, and keeps everything in balance. You don't need to clean it. You don't need to steam it. You don't need to introduce anything into it. It is doing its job without your help. When you expose your vaginal tissue to steam, even warm, gentle steam, you are raising the temperature and moisture level in an environment that has its own precise ecosystem. You are disrupting that ecosystem. The lactobacillus bacteria that protect you are sensitive to temperature changes. You can kill off the good bacteria before you've even touched the bad. And that disruption can cascade. Fewer protective bacteria means a higher vaginal pH. A higher pH creates an environment where harmful bacteria, the kind that cause bacterial vaginosis, or BV, can thrive. So the very practice being sold to you as a way to cleanse and balance your vaginal environment is capable of directly causing the most common vaginal infection in people with a vagina. That is the opposite of what the marketing says. Now add the herbs. Many of the herbs used in V-steaming are biologically active. They're not inert. Wormwood and mugwort, in particular, have properties that can irritate mucosal tissue. Your vaginal walls are mucosal tissue, sensitive, delicate, and absorptive. Applying herbal compounds directly to this tissue via steam is not the same as drinking herbal tea. The exposure is direct. The potential for irritation and allergic reaction is real. And then there's the heat itself, the burns. They happen more than people talk about. Because steam is unpredictable, because the distance between the pot and the tissue is hard to control, and because the vulva and vaginal tissue are not designed to tolerate sustained heat exposure. I have seen patients with burns. It is painful, it is preventable, and it happens to people who are just trying to take care of themselves. Here's the good news, and I mean genuinely good news, because this is one of the most freeing things I get to tell my patients. Your vagina needs almost nothing from you. That is not a failure. That is a feature. Externally, the vulva, the outer area, you can gently rinse with warm water during your shower. That's it. No special soaps, no fragranced washes, no pH balancing products that are marketed specifically to make you feel like you need them. Plain warm water. If you want to use something, an unscented, very mild wash on the external skin only, not inside, is fine for some people. If you have symptoms, odor that's different from your normal, unusual discharge, itching, burning, pain, those are signals that deserve a proper diagnosis. Not a steam session. A real appointment with a gynecologist who can actually look at what's happening, test for it, and treat it appropriately. BV is treated with antibiotics. Yeast infections are treated with antifungals. These are real, treatable conditions. They are not treated with herbs and hot water. If you have painful periods, that pain deserves investigation. Not dismissal, but also not a home remedy that makes you feel like you're doing something when you're not. Painful periods can indicate endometriosis, fibroids, adenomyosis, or hormonal imbalances, conditions that have real, evidence-based treatments. You deserve those treatments. You deserve a doctor who takes your pain seriously enough to find the cause. If you're postpartum and you've been told to steam to heal, please don't. Your postpartum body, particularly in the early weeks, is already going through an enormous amount of tissue healing. Adding heat and herbal irritants to freshly healing tissue is genuinely risky. Warm sitz baths, plain warm water, nothing added, are an evidence-based, safe option for external postpartum comfort. That's it. A lot of people ask me about detox practices for the vagina generally. Here's what I tell them. The concept of vaginal detox doesn't have any basis in how reproductive anatomy works. There is nothing to detox. The vagina is not storing toxins. The uterus is not accumulating residue. These ideas were invented to sell products to people who were never taught to trust their own bodies. If you have been V-steaming and you now have symptoms, burning, increased discharge, itching, pain, or any visible irritation or skin changes, please see your gynecologist. Describe exactly what you did and when. There is no judgment in that room. What matters is getting the right diagnosis and the right treatment. If you've sustained a burn, any redness, blistering, or significant pain in the vulvar area following a steam session, go in promptly. Burns to mucosal tissue can become infected and need proper wound care. Don't put anything on it in the meantime. Don't try to manage it at home. Go in. If you have symptoms that you've been self-treating with V-steaming for weeks or months, chronic itching, recurrent unusual discharge, persistent odor, and it hasn't resolved, that is your body telling you it needs proper diagnosis. These symptoms can indicate BV, a yeast infection, a sexually transmitted infection, or a skin condition of the vulva. None of these will be fixed by steam. All of them can be properly treated once we know what we're dealing with. What will your appointment look like? I'll do a visual exam and, depending on your symptoms, a swab for culture to identify any organisms present. It's quick, it's usually not painful, and it gives us actual information. That information is what leads to actual treatment. You deserve care that is based on what is actually happening in your body, not care that is based on what someone on the internet told you your body needs to feel. I want to end with this. The wellness industry makes a lot of money from women not trusting their bodies. From convincing you that your vagina is dirty, unbalanced, in need of correction, that your period pain is a sign of spiritual blockage, that your fertility is something you can fix with herbs and rituals rather than something that deserves real medical investigation. Your body is not broken. Your vagina is not unclean. Your pain is not something to be managed with steam. It is something that deserves a diagnosis. You are allowed to be skeptical of products that claim to do everything. You are allowed to ask for evidence. And you are allowed to walk into a gynecologist's office and say, "This is what's happening, and I want to know what's actually causing it." That is not dramatic. That is not asking too much. That is exactly what I am here for. If this video helped you or made you rethink something you've seen on your feed, share it. Because someone in your life right now is considering a STEAM session, and they deserve to hear this first. Drop your questions or your reactions in the comments. I genuinely want to know what wellness trends you want me to react to next, because there is a list and I am ready. Subscribe if you haven't. I'm here every week telling you the truth about your body. I'll see you in the next one.